We will discover in this video what to do to cure premature release and last longer in bed. While 1 in 4 men is affected by premature release, many others dread the thought of one day facing precocity. Fortunately, it is possible to take action now to avoid it and definitely keep control over your release. So if you want to prevent yourself from being premature, watch this video until the end. We will share with you different tips, lifestyle habits, tips to apply during intercourse, techniques, etc. How do I know if I am premature? Yes, the first question to ask yourself if you suffer from premature release, or if you simply have rapid emissions from time to time due to fatigue, stress, or circumstances. We tend to say the premature man comes from the act of lovemaking itself, or within a minute of it. This is not wrong, but in reality, the definition of this disorder is more subjective. It is called premature release when the man comes before the desired moment, before the intercourse has been satisfactory for both partners. In addition, there must be psychological suffering. All men are different. If some men can live without coming after 1 minute, others live it very badly. The causes of precocity are varied. Psychological causes, illness such as multiple sclerosis or diabetes, high blood pressure, the aftermath of an operation for prostate cancer, etc. Coming too quickly from time to time is perfectly normal, especially when making love for the first time. No one is at their best 365 days a year. However, this does not mean that you can be described as premature in bed. In order to be characterized, the problem must be repeated every time you have intercourse, for at least 3 months. If you have not reached this point, then there is still time to act to limit these uncomfortable situations as much as possible. If, on the other hand, you do suffer from premature release, following these tips can be a good start to get you out of it. If this is not enough, we recommend that you consult a therapist to find out more about the problem. Number 1. Be relaxed. That's right, being relaxed and unstressed is beneficial to a satisfying and fulfilling love life. As you may know, a spike in stress is often the cause of a faster than usual release. But it is also stress and anxiety, when they take hold, that turn a one-time premature release into a real premature release disorder. Stress makes you come too quickly, which generates stress at the idea that it will happen again, which maintains the problem. It is a vicious circle that is created and is difficult to get out of. So, to prevent this from happening, it is necessary to give special importance to your relaxation. Take time for yourself, rest, do activities that make you feel good, take care of yourself. Meditation and relaxation can also help you relax, as well as regular physical activity to release tension. This way, you can approach intimacy in a relaxed way. Finally, don't hesitate to discuss your fears with your partner. Dialogue is one of the foundations of married life. Your partner can then reassure you and help you to play down the situation. Worries disappear and you are more relaxed. Number 2. Having a good frequency of intercourse helps to avoid precocity. To keep all your libido working properly, it is beneficial to have intercourse, or at least some intimate activity such as self-stimulation. If you don't have enough intercourse, the excitement will build up too quickly when you do make love. And it is indeed too much arousal that leads to premature release. Lack of intercourse can be detrimental to a man's libido. We recommend that you have intercourse 2 to 3 times a week, depending on your possibilities and desires. The idea is to not force you to reach a quota. The lovemaking act must remain spontaneous, desired, and shared. However, if it is possible for you to increase the frequency of your intercourse, you could then avoid coming too quickly. Number 3. Work on your abdominal breathing to avoid precocity. Better management of your arousal automatically means better control of your release. To do this, you can learn to manage your abdominal breathing. This one must be slow and controlled in order to slow down the rise of excitation. Moreover, By not breathing too fast, you will feel better the imminence of the release. This allows you to react by taking a break, for example. This is what we call corporal breathing. Combined with a good movement of the pelvis, double rocking, it allows you to bring down the pressure. Therapists also advise you to strengthen your perineum, the muscle between private parts and the bottom. This has similar effects. Yes, knowing your body and how it works is very important. This breathing method allows you to be more anchored in the present moment and to feel everything that is happening in your body and around you. This is how you regain control of your release. On the other hand, it is possible that your precocity is due to rigidity dysfunction. If you want to know for sure, fill out the questionnaire in the description and you will have the answer in 5 minutes. Number 4, reduce arousal. You have understood to come less quickly. Everything is played in the control of the excitement. It is indeed the sexual excitement that acts as an indicator. As soon as it reaches its peak, the brain triggers release. This is the body's response to the high level of arousal. So you need to be able to reduce your arousal when you feel it rising too quickly. To do this, avoid thinking about images that are too exciting. Also, don't watch adult movies before or during intercourse. The memory of these images could make you come too soon. If necessary, during intercourse, you can close your eyes and try to think about something else. Thoughts that have absolutely nothing to do with desire allow your arousal to subside and make the pleasure last longer. Be careful, however, not to make your hardness fall back. Number 5, take your time. To avoid coming too quickly, you need to take your time. First of all, linger on the foreplay. Caressing, eye contact, giving or getting head, etc. will help you build up your excitement slowly, as well as sharing a beautiful moment with your partner. Don't rush into intercourse, even if your hardness is at its peak. Take the time to appreciate these little things that are already a great source of pleasure. When the moment of entering arrives, go slowly. The first thrust should be gentle to give manhood time to get used to the warm and humid, and therefore very exciting, environment of the lady part. Then, the back and forth movements should be slow, to better feel the sensations and the rise of the excitement. Don't hesitate to take breaks and return to other practices that are less focused on intercourse in order to bring the pressure down. Finally, opt for more passive positions for the man. This way, you are less stimulated and have more control over your arousal. This is how pleasure can last longer. Number 6, knowing your point of no return. This is one of the keys to avoiding precocity. Knowing how to spot your point of no return is fundamental to last longer in bed. The knowing of no return is the movement when climax is imminent. It's about to happen and you can't stop it. This is the emission reflex. Body breathing techniques can help you feel it with a little practice. So can the squeeze techniques, blocking release by compressing the tip so that the fluid doesn't come out, and the stop and go, stop the back and forth just before release so that the excitement goes down, then resume, can be useful at first. If they have their limits in the treatment of a real premature release, they can allow you to train yourself to spot this famous moment when release is very close. Then you'll be able to see the warning signs and know your limits before climax. You can also check out our video, How to Increase Stamina in Bed, to discover other practices to delay climax voluntarily. Number 7, overcoming precocity, wearing a condom. Wearing a condom can help some premature men last longer. The latex sheath unrolled over manhood reduces stimulation of the tip and thus the rise in arousal. It is a way to delay release. Be careful, however, as the condom can also have the opposite effect and cause the hardness to fall back. You should also know that there are delaying condoms specially designed to avoid precocity. Their thicker tip allows them to limit even more stimulation of manhood's tip. It's up to you to test them to see if they work for you, or if on the contrary, manhood stimulation is no longer sufficient. It's important to find the right balance. Good to know, a well-lubricated manhood and lady part can also limit premature release. There is less friction, which slows down the rise of excitation. Don't go easy on the lubrication. What if these tips don't work? If, in spite of applying all these tips, you continue to come too quickly on a regular basis, then we recommend consulting a therapist. Sometimes tips and tricks are not enough and expert advice is needed. The doctor will be able to find the causes of your disorder and direct you to the most appropriate solution, including drug treatments. The goal of the process is not necessarily to last in bed as long as possible. The goal is rather to reach climax at the desired time after intercourse that is long enough to be satisfying for both partners. Keep in mind that precocity is one of the most common disorders along with rickety dysfunction. It is true that being premature is not easy in our society. It is a taboo subject. Men suffering from this disorder often have a low libido because of the negative psychological consequences. If you are experiencing these difficulties, get help by consulting a doctor. Taking care of the health of your libido is as important as your mental and general health.